clear for the formal protocols. Catherine?
Good morning. We'll start with roll call this morning. I think we've been doing the electronic meetings for enough time that we don't need the protocols read, particularly since we decided at the last council meeting that the recorded votes will only be at the request of a member, that there will no longer be any recorded votes. So we'll get started with roll call. Mayor Brown.
I'm here. Can you hear me?
Yes, thank you. Good morning. Councillor Carlson.
I'm here, thanks.
Thank you. Mayor Crombie indicated that she would be late this morning. Councillor Demurla.
Present. Good morning.
Good morning. Councillor Dasco.
Good morning.
Good morning. Councillor Dillon.
Good morning.
Good morning. Councillor Downey.
Present.
Good morning. Councillor Fonseca.
Good morning.
Good morning. Thank you. Councillor Fortini. Councillor Fortini. Councillor Groves.
Good morning, President.
Good morning. Councillor Early is here for Councillor Innes today. Councillor Early.
Good morning.
Good morning and welcome. Thank you. Councillor Kovac.
Good morning.
Good morning. Councillor Mahoney.
Good morning. I'm present.
Good morning. Councillor McFadden.
Good morning, everyone.
Good morning. Councillor Medeiros.
Here.
Good morning.
Good morning. Councillor Paleshi.
Present. Good morning.
Good morning. Councillor Parrish.
Here. Good morning.
Good morning. Councillor Raz.
Good morning.
Good morning. Councillor Sato.
Here.
Morning. Councillor Santos.
Present.
Thank you. Councillor Sinclair.
Here.
Good morning. Councillor Starr.
Present.
Thank you. Mayor Thompson.
Present. Good morning, everyone.
Good morning. Councillor Vicente.
I'm here, present.
Thank you. We have quorum. Thank you, Chair.
Thank you. On to our Indigenous land acknowledgement. We would like to begin by acknowledging the land on which we gather and which the region of Peel operates is part of the treaty land and territory of the Mississaugas of the Credit. For thousands of years, Indigenous people inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is also home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land and by doing so, give our respect to its first inhabitants. And I remind our first inhabitants that I'm really looking forward to our session next week with regards to reconciliation that we've got scheduled for Wednesday as we try to keep moving in the right direction. So thank you very much for that. Next, do I have any declarations of conflict of interest? Hearing none. Approval of the minutes from the September 9, 2021 Regional Council meeting. Madam Clerk, do you have a resolution?
Yes, I have a motion moved by Councillor Mahoney, seconded by Councillor Early, that seconded by Councillor Downey, that the minutes of the September 9th, 2021 Regional Council meeting be approved. Are there any objections? Seeing none, carries.
Thank you. That brings me to the approval of the agenda, and a shout out to my colleagues on behalf of the staff. You'll note it's one of the rare times we don't have a overflowing additional agenda, and it's very much appreciated that we're trying to follow the protocols of getting the information to the clerk's office in a timely manner. I want to thank all of you for having done so, because it allows the back office to run much more smoothly. So well done, and thanks on behalf of the clerk and the team here. Okay, we're starting up with another proclamation with regards to the United Way kickoff. So I would like to take a moment to highlight some of the great work that the United Way of Greater Toronto is doing as they launch their annual fundraising campaign termed Show Your Local Love Day. The United Way of the Greater Toronto 2020 Local Love Fund provided funding to 280 community agencies so they could provide critical support and services to vulnerable residents across Peel, Toronto, York Region, and others during this pandemic. Our Region of Peel employees have also been working to support the Peel community during this pandemic. From the period of September 27 through October 22nd, staff will participate in our annual United Way employee campaign, which will be 100% virtual this year, and will make personal financial donations to support Peel residents in need. I'd like to thank our staff in advance for their contributions, and please take the opportunity to visit the United Way website for more information on the 2020 campaign, Show Your Local Love Day. Thank you very much to all. Thank you for the great work that Daniele Zanotti is doing at the helm there as well in a great time of need. So thanks to all for that. Okay, I need a approval of the agenda, a formal vote, Madam Clerk. Would we taken it for the approval of the agenda?
For the approval of agenda, it was moved by Councillor McFadden and seconded by Mayor Thompson. Any objections? Seeing none, it's approved. Thank you.
And Madam Clerk, why don't you carry on with our consent agenda?
Thank you. We'll just go through the agenda. We have the delegations at 7. We have Dr. Lowe's presentation at 8.1. We have a staff presentation at item 10. And then we get to item number 13.1. Peel 2051 Official Plan Review and Municipal Comprehensive Review Draft Amendment. The requirement to hold statutory open houses in a public meeting. It's a consent.
Please hold.
Held by Councillor Parrish. Thank you. Item 14.1 is a piece of communications. It's a letter received September 14th from David Pinchney. It's a consent. On consent. Items 15.1, transfer a Region of Peel additional one-time Canada Community Building Fund allocation for 2021. Consent. Thank you. It's on consent. 15.2, the 2022 Regional Council and Committee meeting schedule. On consent. Item 16.1, communication from Peter Bethnelfeli. It's a letter received September 9th. On consent. Item 17.1, transfer of Embleton Road from the Region of Peel to the City of Brampton.
Hold, please.
Held by Councillor Parrish. 17.2, the Waste Management Financial Plan, the update on potential funding approaches and public consultation. It's on consent, thank you. Item 18.1, correspondence from Carolyn Mulrooney, Minister of Transportation, dated September 13, 2021. On consent. Item number 19.1, Healthy Babies, Healthy Children Funding, supporting Peel's vulnerable families. On consent, thank you. And then we're down to the bylaws, and then in camera, item 24.1 is the minutes from the previous session. On consent, thank you. And item 24.2, an expropriation proceedings on Steeles Avenue, for the Steeles Avenue widening. And it's on consent as well. So we have a motion moved by Councillor Sado and seconded by Councillor Sinclair that the consent agenda be approved. Any objections? Seeing none, carries. Thank you.
Thank you, Madam Clerk. So that brings us to delegations. Our first delegation, 7.1. Parampal Singhil, resident of Peel, regarding negative implications of the COVID-19 measures. Parampal, welcome, and I remind you, you have a 5-minute maximum for your presentation. Please proceed.
Hi, my name is Parampal, and I'm here for my speech. Thank you for giving me an opportunity to speak up today. I'll be sharing my experiences and struggles over the last 2 years regarding the COVID-19 policies. As we might aware that a vaccine partner passport has implemented in Ontario yesterday. What a sad time we are in. I never imagined I would be saying this, but this is not the Canada I thought I was moving to. I left my homeland and chose Canada because it was supposed to be a peaceful, justful country that respects human rights at all. But seeing this track has been taken recently, I'm very concerned for my safety of my health and life. It feels like I'm living a life under a medical dictatorship. Now we have lost our freedom so much that I cannot freely choose the right thing for my body. Did the authorities think even how much people will have to suffer because of these decisions they are making? Uh, to cite my own example, I'm allergic to the multiple medications. So I got seriously ill after my first childhood vaccine, and I didn't get any after that. So now I have committed to a healthy lifestyle, and to look at me, a healthy man surging without any vaccine or medicine. So after suffering so much from the first childhood vaccine and having a bad reaction to even the regular counter medication such as Tylenol. So um, how does it even make sense? So I should take the risk of getting a COVID-19 vaccine, risking my health for a virus which has a survival rate of 99.8%. So I actually survived with COVID without a single symptom, without any medication or vaccine. So there's no strong, justful reason to get vaccinated and put my health and body at a risk. So in case if something happens to me in my life, who is liable? So I have witnessed the people in my social circle having all sorts of issues, uh, heart issues, menstrual problems in the woman. So what's common in all among all the people is that all the doctors are dismissing the link between vaccines and the side effects. So after seeing this, why should I take the risk? And the side effects I mentioned were the short term. So, and for the long term, we didn't even know the effects yet. So how can we say that a vaccine is safe even we have no idea of the long term effects? And if the vaccines are really effective, why should one be concerned if the other person is vaccinated or not? So they should be technically be protected already. So we are hearing about a possible boosters now and new variants every 2 months. And this makes me wonder that will there ever be an end to these vaccines and boosters because viruses and variants won't end. And government talk about a zero COVID, but this is absolutely unrealistic. It's like chasing one's shadow. Eventually, it will only exhaust us and waste our precious time and resources and lives. I wonder if we have already done more harm than good with the measures we have taken so far. So I saw in the news a couple of weeks ago that one MPP was kicked out of the party for refusing to get the vaccine, and many people were under impression that your employment would not be impacted by the post vaccine. But now it's happening provincially and in the field. So apart from my health, many people. So apart from my health, I'm also equally concerned about my career now, and how I will make my living. Last week, I was applying for a new job online, and and I saw some employers posted job listings that were only reserved for those who are double vaccinated. I can't believe this is Canada. Why more privilege and job opportunities for vaccinated and less for the unvaccinated like me? I'm a hard
One
working.
more minute to wrap up, please. I'll give you one more minute
Yeah,
to conclude. Thank you.
yeah, it's clear. Yeah. So there shouldn't be a money consider my qualifications and skill for the job. So there might be around 15 to 20% people who are still unvaccinated, but maybe they have their own choices. So, and there's a one Bar Roman Babar MPP from Etobicoke. He is double vaccinated, but he stand up for the right of people who choose not to. And my religion also choose that we even think that we disagree with that. So I thought this is what Canada, all of you were about. So, so what is happening right now? It's a clear violation of equal rights and opportunities. Vaccine passports will create more discrimination and divide our society, which is not good for the economy growth of Canada. I request the region to work on the concern about the vaccine passports and mandatory vaccines and provide equal rights to all the Canadians. So I use this platform to speak up. People who are not vaccinated will be discriminated more and more every day in the day-to-day activities and also feel left behind other So,
Parampal, we will thank you for your presentation. You've articulated it very well. I see I have no questioners on my list, so I'll ask for receipt of the delegation. Moved by Councillor Dillon, seconded by Councillor Kovac. Anybody opposed? That's carried. Thank you very much for your delegation. Our next delegation, 7-2, is Kamalpreet Singh, founder of Go Satvik, regarding politics involving medicine and immunization. Kalampreet, please proceed, and you two have 5 minutes.
Good morning, everyone. Thank you so much for giving me the opportunity to speak and express my concerns. Is my voice audible, sir?
You're perfect. Carry on.
Thank you. So for almost 2 years, our lives have been taken a turn which we never imagined with this COVID-19, a virus that majority of the world seems to be afraid of. And like everyone, I also panicked in the beginning. However, with time, I would often see multiple contradictions among doctors, public health officials, scientists, and other academics. I did not see any fair debate on any platform. And instead of being led by fear, I then decided to evaluate this and do my own research calmly and rationally. And so today I will be sharing with you some points that I think are well worth for discussion and investigation. So first of all, in this whole scenario of this COVID-19 pandemic, the diagnosis mechanism, which is a PCR test, is what I think is the root cause of the problem. Because the inventor, Dr. Carey Mullis, who made this PCR test, he said that this test can detect anything in anyone if multiple applications are done. So if the CT cycle, that is the cycle threshold, is increased above 30 or 35, then it can show anything as positive. So he said that this test is not meant for diagnosis. So in 2020, if we see Ontario's Associate Chief Medical Officer of Health, Dr. Barbara Yaffe, they admitted on TV that half of the COVID test results are false positive. So the thing is, if our diagnosis is not reliable, how can our treatments and COVID measures be accurate and justifiable? If we talk about the Toronto Public Health they admitted in 2020 that individuals who have died with COVID-19 but not necessarily as a result of COVID-19 are all included in the case counts for COVID-19 that's in Toronto. That means, in other words, if you go to the hospital due to pneumonia or heart attack and if you test positive for COVID and die, the reason for your death will be considered COVID even when you are dying with COVID and not from COVID. So this is how the death rates are being inflated. This is what I feel. And Dr. Brown from the University of Waterloo, they call the COVID fatalities as the worst miscalculation in human history. In USA, according to the CDC, the COVID survival rate is approximately 99% for those under 65 age and 95% for those above 70. So according to a recent study, the global survival rate is 99.85%. So does this sound like a true, really deadly pandemic? I don't think so, because there are much more cancer deaths, there are much more heart attack deaths, and even more hunger deaths. You know, there are 9 million people that die every year from not getting food, from starving. So this is much more than the COVID-19 deaths, and it's very simple to finish this pandemic of hunger by providing food on every plate, and which is much easier than giving this experimental gene therapy, which we are going to talk about now. So moving on, the vaccines that are being forced upon us are still in the trial phases until 2023. None of the vaccines, Pfizer, Moderna, or the J&J, none of their clinical trials finish before 2023. In other words, they are being experimented on us humans, and long-term effects are still unknown, as they require several years of testing, which has not been done in this case. So in case of an adverse reaction, you cannot hold the vaccine company liable, as the government gives them immunity. And I personally know people who have had adverse side effects, including facial paralysis, and healthy young women who have had periods which lasted even 4 weeks. And why is this dismissed and not taken seriously? And when doctors from Ontario like Dr. Phillips is trying to report these cases, then it's not taken up. And if we talk about the mRNA messenger RNA technology, the single most qualified person on this topic is Dr. Robert Malone. He was the inventor of the mRNA, and he recently advised against these vaccines and said that no one should ever in his right mind take this vaccine, especially for children and younger adults. So according to a Lancet paper, the actual efficacy of these vaccines, because these companies said that this vaccine is 95% effective and 93% effective, when we go to the Lancet journal, it said that the actual risk reduction is only 1 or 1.2 percentage, and it is nothing to do with the 95 percentage, which is a relative risk reduction, which is a false way to propagate the efficiency. So this is quite different, which is being told by the mainstream media. And also the research shows that vaccine immunity fades in a period of like 2 to 3 months, whereas natural immunity can last for decade to a lifetime. Even then, after knowing this research, natural immunity is almost completely absent from the media, as if it does not exist. None of the doctors is saying that you should exercise, you should go in the sunshine, you should love and meet your friends and family, and everyone is pushing this experimental gene therapy, which was not approved a few months ago back, and it was experimental. And a lot of you may not know, in 2019, Pfizer had to pay $2.3 billion for fraudulent marketing, for bribing their doctors for the products which is not as effective as they claim to be. Similarly, Johnson & Johnson was fined $1.2 billion for deceptive marketing and $70 million for bribing doctors in Europe. And their baby powder killed so many females from ovarian cancer. And then the lawsuit was filed and they got this claim. So how much, and everyone does not report these damages, and these lawsuits are not always filed. So the unheard and unreported damage is so much. And if we see the vaccine adverse event reporting system of America, in about a period of 7 months, you see there have been 14,000 reported deaths. And according to a Harvard study, this is just 1 to 10% of the total injury which is being reported. So you can imagine the extent of
sorry, that's 5 minutes. Kamalpreet, 1 more minute to sum up, please.
Okay, I'll sum it up. So with a criminal history like that of these companies, how can we blindly trust these companies? And lastly, the evidence shows that the vaccinated people can carry the same viral load as unvaccinated people. Vaccinated people can also spread COVID. So how does it make sense to create so much fear of the unvaccinated and blame them? How does it make sense to ban the unvaccinated people from work and the community? Unvaccinated people are not a threat to the vaccinated people. Your vaccine protects you, my vaccine protects me. The aggressive measures being used to force the vaccine are very unethical. They violate the free informed consent and will make unvaccinated people sound like second-class citizens. So we need to stop discrimination. We need to come out and fix this by our single approach and broaden our lens. So stop forcing people and respect all our rights to choose and what goes into our body. Please answer, how will you ensure that you consider all the facts and protect all our rights? Thank you so much for listening to me.
Kamalpreet, thank you very much for your presentation. I have no questions. Oh, sorry, just Mayor Crombie. Mayor Crombie, please proceed.
It's just a point of information, Mr. Chair, not on the deputation, but you mentioned a Truth and Reconciliation event next Wednesday?
Yes.
Next Wednesday, we all have council meetings.
Yeah, and we've dealt with Mayor Crombie. Can we deal with that at the end of the agenda under inquiries, perhaps?
Sure.
Thank you very much. But you'll move receipt of the delegate, seconded by Councillor McFadden. Anybody opposed? That is carried. Thank you very much. Thank you for your presentation, Kamalpreet. Okay, that brings us in a timely way, I think, to our COVID-19 update. Update on the Region of Peel's response to COVID-19, an oral presentation from Dr. Lawrence Loh. Dr. Loh, please proceed.
Yes, thank you. Good morning, Chair and members of Regional Council. I appreciate the opportunity to present an update on our ongoing COVID-19 response. Today's report will focus on a status update of COVID-19 in Peel and vaccination, some information on public health measures, and also our planned next steps. The Region of Peel continues to monitor for COVID-19 transmission in our community, and in the past 2 weeks, case numbers have continued to be high at an average of 90 new cases per day, but are remaining mostly steady at that level with no major change in the incidence rate over last week, 37 per 100,000. We are managing a number of large community outbreaks, most recently through life celebrations such as weddings and birthdays, organized social gatherings, and also seeing a significant a number of outbreaks in nightclubs and resto bars and restaurants. Since August 1st to September 15th, there have been approximately 12 outbreaks in all of those specific settings, accounting for over 170 cases. And those cases have increasingly complex contexts to trace, given attendees from across regions, challenges with knowing who exactly has attended these events. We're also seeing some complex outbreaks related to interjurisdictional sports tournaments. And so to interrupt transmission during these outbreaks to support outbreak investigations and contact tracing, we really do encourage venue operators, event operators, people who are hosting these to work with public health, ensuring that they keep contact lists, disclose any exposures, and please isolate and test as directed. We do still have a number of residents in our community who are still susceptible to COVID-19, not yet fully vaccinated with 2 doses. And we also encourage residents to reduce their discretionary contacts as much as possible and take the opportunity for themselves to be fully vaccinated to help reduce risk overall. We do know that schools have reopened. The last 2 weeks of data show that there have been nearly 60 cases picked up in school and childcare settings. However, these are mostly cases that have been introduced from the community. We continue to closely monitor the school setting, and it is still a bit too early to assess what impact the return to school and basically a return back from summer into fall will have on transmission patterns in our community. Then turning to vaccination, we continue to collaborate with primary care, pharmacies, hospitals, and community agencies. As of September 17th, we have 85% of Peel residents 12 plus with 1 dose, and we have 78% who have received 2 doses. I think all of us are seeing with concern what is happening in Alberta, where Alberta's population coverage is currently at 72% of the population with 2 doses. So we really strongly encourage remaining eligible Peel residents, please don't be part of the 4th wave in hospital. Please get vaccinated and make sure that we're protecting each other, ourselves, and also our most vulnerable citizens, and working to keep children in school. To support ongoing vaccination, we are continuing various targeted clinics throughout Peel. We launched the Peel Vax Van last week, which is running to neighborhood clinics in post-secondary schools, shopping malls, places of worship, fairs, parks, and more. We've also launched vaccination hubs at over 15 schools in Peel. These will continue to be supported by strong partnerships with community organizations that have close ties to neighborhoods and communities to help build trust and remove barriers to vaccination. We've also partnered with the province to bring their GoVax bus to various places in Peel to also increase access and convenience. Then turning to public health measures, in recent communications that I provided to Council, we did outline the way that the province will be providing guidance and in which the province will be supporting the proof of vaccination policy as well as expanded eligibility for 3rd doses. Yesterday, we saw the launch of the province's proof of vaccination certificate program, which really helps to protect susceptible individuals in high-risk indoor and non-essential settings where precautions can't be consistently maintained. The Region of Peel is working with local municipalities and the province to support implementation of this policy. Enforcement is complex. However, the initial emphasis on any enforcement is about public education, working with and supporting operators, and supporting individuals to get vaccinated should they choose to at this juncture. I want to emphasize as well that we see the vaccine certificate program as a temporary measure for non-essential settings to keep these settings open, to avoid broad-scale lockdowns, and to make sure that we are mitigating the impact of COVID-19 as we head into the fall and winter, and as we move closer and closer towards a declaration of endemicity. So it is really important that we continue to have residents support case, contact, and outbreak management. We're seeing a lot of localized increase, especially in settings that were closed in previous waves, such as events, social gatherings, restaurants, etc. We will continue to monitor the impact of school reopening on case counts and also work with school boards to continue implementing required public health measures. I really urge eligible residents to get vaccinated now to protect not only themselves, but the opportunity for our children to continue learning in person by reducing introductions into the school setting. We're also monitoring the potential impacts to hospital capacity. We are still seeing COVID-19 related hospitalizations and ICU admissions every week. These are almost exclusively individuals who have not yet received 2 doses of vaccine at this point in time. And as we head into the fall season, we also continue to recommend that individuals with any symptoms whatsoever, not related to receiving a COVID-19 vaccine, so basically anyone who's sick, they should not attend school, childcare, or work until their symptoms are improving. And individuals with symptoms, including those who are fully vaccinated, should also complete the self-assessment and seek testing just to ensure that they are not positive with COVID-19. So with that, Mr. Chair, members of council, I'm happy to take any questions that you might have at this time.
Thank you. And we have a couple. Councillor Groves.
Thank you, Mr. Chair, and thank you, Dr. Lowe, for the presentation. Just a quick question. Recently, Mackenzie Health or the Portalucci Vaughan Hospital put something out regarding the associating myocarditis with the Pfizer vaccine. Can you comment on that, and especially in young adults, and I think it's in young male adults that they were concerned about this myocarditis. So can you comment on that?
Yeah, so through the chair, thank you, Councillor Groves, for the question. Myocarditis is a safety signal that was identified with the mRNA vaccines. It's important to stress that it is a very rare side effect that has been noted in young individuals, usually young males. It is also a very mild side effect. Most of the cases of myocarditis tend to resolve either spontaneously or with conservative therapy, and there are no ill long-term effects that have been noted or are expected or anticipated with that condition.
Okay, so just a follow-up to that. So my son, when he was born with a pulmonary stenosis, and so is there a risk to him getting the mRNA vaccines?
So through the chair to Councillor Groves, at this point in time, the only two contraindications to receiving mRNA vaccine, the medical exemptions that are supported by the College of Physicians and Surgeons of Ontario, are individuals who have had any anaphylactic reaction to any of the components of the mRNA vaccine, or individuals who have previously had myocarditis following an mRNA vaccine at this point in time. So that list of exemptions is fairly short, and obviously I would recommend that you speak to your primary care provider just to confirm the specifics around your child's medical history, but those are the two contraindications, the two medical exemptions that the College of Physicians and Surgeons of Ontario is permitting at this time.
Okay, thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chair, and thank you, Dr. Lowe, and to staff, ongoing as always. Hopefully life will get a little bit easier for you and everyone else in the near future. I want you commented about the GoVax bus, and I want to say I was thrilled to have it in my ward at the RibFest this past weekend. And the operators at the bus were absolutely flabbergasted at the response. They actually had a lineup before they opened in the morning, and within the first 2 hours, they had over 65 people had come in to be vaccinated, and they brought 150 vaccines with them, thinking it would last them the entire day, and I hope it did, because they were going until 7 o'clock. But when I was there, what I noticed was a lot of younger adults were coming in to get their vaccines. There was one family with their young children. And I noticed that both the children and the father were sporting their vaccines, but the rest of the people that were coming in seemed to be of the 20s, 30s age group. So that was a really good thing to see. So I really appreciated having that, and I hope we'll have it more often in the plazas, because that's where it's easier at the shopping centers for people to get to it. With regard to the vaccination certificate, and there's a lot of confusion over this, maybe you can clarify. We were told we could print out the receipt that we got, the certificate that we have, which is what I've done. I've saved it to my phone, and as have a lot of other people, because I received it as an email. And but now we're hearing that the one that you download, which seems to be, for some, it's a lengthy process because they're staggering. I guess they have a virtual waiting list on the website. Has a different watermark on it. So there seems to be a lot of confusion as to what is actually legal when you go in. I mean, I think all of them can, my understanding is all of them can be edited on a PDF. So none of them are 100% secure. But what is the province actually requiring when someone goes into a non-essential location and has to show it?
So thank you. Sorry, so through the chair to Councillor Sato, thank you so much. My understanding is that any of those proofs, either the ones that were provided at the time of vaccination or the ones that can be downloaded from ontario.ca/proof of vaccination, would meet the test under the letter of the law, I believe. Essentially, the law really requires that the individual just show proof of having received 2 doses and also an ID badge. So, you know, I myself just have a photocopy of the one that I received at the time of vaccination in my wallet, and I also have a PDF on my phone just for backup. So, so I think any of those would be acceptable. And certainly, if there are any questions, people would always be able to go to the website and to be able to download that PDF at that time. I actually just checked today, and I don't think there's a virtual waiting room today. So.
Yeah, I'm sure everyone was trying to rush thinking they were going to need it yesterday. And if you're not going anywhere, that's not essential. You know, you can pretty well wait until you need to go eat in a restaurant, I suppose. So, yeah, the other item, and it's not really related to you as much as to the chair. I was absolutely thrilled to see that the Premier of Quebec is passing legislation to ban protests outside hospitals and healthcare centers. And I would encourage Mr. Chair and Dr. Lowe that we as a region encourage the province of Ontario to do the same thing. You know, I'm absolutely impressed with the actions that the Premier in Quebec has been taking all along with COVID, with, you know, the vaccine passport, getting the app, and now taking that action that you and other healthcare workers are asking for, because quite frankly, it's disgusting for people to go and protest in front of a hospital just because they don't like the law and putting other people's lives at risk. So I would encourage, Mr. Chair, that if we can do something from the region of Peel officially to make that request to the province of Ontario. I think we should be supporting our public health workers and our healthcare workers in the hospitals as well. But thank you, Dr. Lowe.
Thank you. And Councillor Sato, thank you very much for the suggestion. I've got to extend kudos to your mayor, to Mayor Brown and Mayor Thompson. The recent session that we had with the mayors and chairs with John Tory, this very point was discussed. As you're well aware, we know we cannot order our police to do certain things, but the concern was certainly expressed that something needs to be done, has to be passed on to the Premier. But I still think your suggestion is a very good one. Why don't we go ahead and do it on behalf of the region of Peel as well? So why don't you let the chair take that away, draft something that I hope the 3 mayors will be happy with. We'll work together, assuming they agree. But we've all agreed. Who could disagree with what you're saying? But as I said, we've already knocked on that door. Maybe we will knock again as per your direction, and I'll be reaching out to the mayors. We all support you emphatically. What a grave injustice to our healthcare workers. Talk about adding insult to injury. But thank you, well said, and we will follow up with that. Next up,
Mr. Chair, sorry, Mr. Chair, I think something like that, it's great coming from the mayors, but if it doesn't have the council behind it, it doesn't really have as much impact. So I would ask that, and I didn't prepare anything, but I would ask that we even do a straw vote of council so that you can go forward and say regional council is making this request. I think regional council making the request, quite frankly, has a lot more impact than 3 members of that council making the request, even though they are mayors.
Councillor Sato, well said again, with kudos to the mayors for stepping up as they have. Councillor Sato, I need to take that as direction right now from you and Mayor Crombie.
If it's direction, yeah.
And is there anybody in opposition to that? Hearing none.
Can I speak to that, Councillor Dillon?
Okay, so I'll tell you what then, I was hoping that Councillor Sato, when I'm done with my list, I will come back and take that formally. So to everybody who wants to speak to that, you will have your chance. I tried to do it a little bit more quickly, but let's carry on with this presentation and then I will deal with that matter as a standalone item.
Chair,
Councillor Sado,
Chair
that's
Unica,
acceptable.
if I may, perhaps that could be a motion from Councillor Sado, and if we could get a seconder,
Exactly.
then, and I believe I heard that Councillor Sado would like it to be a recorded vote when we get there. I see Mayor Crombie is seconding the
Absolutely.
motion, and so then.
Councillor Dillon, I'll speak to it when it
Now-
comes. Thank you.
Absolutely, and anybody can speak to it, but I will deal with it formally as moved by Councillor Sado, seconded by Mayor Crom, and everybody will have their turn at that. I'm going to, Councillor Sado, if that concludes your questions on this subject for Dr. Lowe, I will move on with my list for questions of Dr. Lowe in his presentation. Parish, Demerla, Raz. Councillor Parish.
Yes, thank you, and welcome, Dr. Lowe. I noticed, despite keeping your hair very short, there's a little frosting of gray on it now. I think you've had a rough 18 months, and we appreciate what you've done. We're at 78% double dosed. What are you aiming for as one that brings normal life back?
So through the chair to Councillor Parish, it's difficult to know exactly what the threshold is. However, the science table has said 85% is needed to mitigate the fourth wave. And I think Dr. Kieran Moore, the Chief Medical Officer of Health, has been very clear about his aspirations for at least 90% or more. In essence, what it is in getting normal life back is a move towards endemic versus pandemic. And this disease will become endemic when it's no longer novel to the vast majority of people, meaning that people have, the vast majority of people have either been infected or vaccinated. And at that point, that's when it becomes endemic. We don't see waves anymore, and then we can kind of get back to normal. So really, the faster everyone gets vaccinated, the faster we'll be able to make this virus a little less novel and hopefully move towards endemicity.
Well, thank you very much. Through you, Mr. Chair, I want to compliment Dr. Lowe on the bus going into Westwood Square. I had a meeting with the Caribbean Seniors Club, and a lot of the Caribbean population in Malton has been reluctant to get vaccinated. And they proudly announced on Tuesday morning to me that all 157 members of their club have been double vaccinated. So you made it easy for them, and they responded well. So thank you very much. It's been a long haul trying to get those buses on the road. It was my deep desire to do it, but you've done a lot of work in Malton. It's obviously one of the hot spots, and the whole team, your whole team's done a lot of work in a lot of different schools and locations up there. Just wanted to thank you very much.
Well said, Councillor Parish. Thank you. Councillor Demerla.
Thank you, Chair, and thank you, Dr. Lowe, for the update. As you know, I've been trying to work with you and Brian Landry and everyone on the areas around Hurontario and Dundas, which continue to lag in vaccination. And I will say I'm disappointed. You know, when I keep reading emails that say there's a vaccination bus, there's mobile clinics, but then I don't see anything at Hurontario and Dundas. I know you had one clinic at the Newcomer Center, and thank you for that. But I'm just wondering, if you have a Vax bus, and we know that the Hurontario and Dundas area has low rates of vaccination, why wouldn't you pick a mall there in your first, short list? Like, I go through the list looking to see if that area is there. And I find it somewhat disappointing that, even though I keep raising it, and I know you guys, want to do that. Plans to do a vaccination for the Polish community.
Yeah, so through the chair to Councillor Demerla, I'm sorry to hear about your disappointment. Certainly there are lots of areas in the region of Peel that are experiencing low uptake, including, Cooksville. And we've been very, I think we've been very responsive, I believe, to your entreaties and to your various emails. As I've said, there is plenty of work that has happened and that is planned to happen there. We do, of course, Councillor, request that you yourself also encourage residents to come and get vaccinated. There is that other element of personal responsibility in making use of the offerings that are brought forward. However, I am assured by Brian Laundrie that there is a multi-phased approach to all the high priority areas, that they are working with various community organizations to address needs as best as possible. I understand that the mobile Vax van, which just launched, will now be also going to various areas of lower uptake and will make appearances in your neighborhood and in your ward. So I really want to reassure you that we haven't forgotten about your area. It was a priority area. It was named as one in recognition of that. And I think our goal is really just at this point to try to get where we can, when we can, and also really encourage residents to step up and roll up their sleeves as well.
Can I get some timelines as to when a bus might appear in Cooksville?
Through the chair to Councillor Demerla, I can't confirm an exact timeline because I know the team has been working on it, but I understand it'll be within the next couple of weeks.
Thank you. And can I get an update on the plans for, vaccination clinic for the Polish community?
Through the chair to Councillor Demerla, why don't we take this offline? I'd be happy to have Brian and our team meet with you to provide you a fulsome update about all the work that is happening in L5A and L5B.
Okay, and to the chair, Chair, I just wanted to, on the issue that Councillor Sado raised, I guess this is not the time to speak to it, is it, or is it now that you want?
No, there will be a formal motion. We will deal with it standalone after we've dealt with the presentation, and you and everybody else will have a chance to join a fulsome conversation, I'm sure. So I'll note you for that to come momentarily. I will carry on with my list for now for questions of Dr. Lowe. Councillor Raz.
Thank you very much, Mr. Chair, and thank you for your update again, Dr. Lowe. I think one of the challenges that we have with kids going back to school is the inconsistency of information that they're receiving. And I've received a couple of calls and have dealt with another issue. If there is a cohort that that has an exposure, do they get a PCR test right away and also a test on day 7?
Through the chair to Councillor Raz, basically this stuff is all covered in the dismissal letters that are there. I do believe that's the case. I just need to pull up the letter to be sure. But I believe it depends on the nature of the cohort and the exposure, and certain letters are sent to certain people based on the investigation and also their vaccination status. So I'd have to, sorry, my computer's not loading the letter.
Oh, that's okay. And in terms of what's our general testing availability for COVID tests for asymptomatic residents?
Yeah, so through the chair to Councillor Raz, at this point in time, test capacity is something that we're actively discussing with our Ontario Health Central Region colleagues. We do know that with the return to school and with the dismissal of cohorts amongst that large unvaccinated population, that the access to timely testing is crucial. I believe that people are still able to get tests within 1 or 2 days, but the issue, of course, is that as more and more introductions occur in schools, they're going to need to make sure that capacity gets ramped up. So we're continuing to monitor, and we're continuing to have that conversation, constant conversation with our Ontario Health colleagues to ensure that the testing capacity is maintained.
Okay, great. Thank you.
Thank you. Mayor Brown.
Chair Unica, and thank you, Dr. Lowe, for your ongoing leadership in keeping us all as safe as possible during these difficult times. One thing I wanted to get your response on, I know we had a chance to speak about it on Wednesday for the benefit of Regional Council. Prime Minister Trudeau pledged during the federal election campaign that $1 billion for vaccine certificates would be delivered to the provinces, and right now it's uncertain whether funds will be passed on to municipalities. We've looked at the numbers locally in Brampton with the costs that are going to come on by law for enforcement. Will there be costs for Peel Public Health, for the public health inspectors, and would it be helpful if we ask for a portion of that funding from the province for public health to help administer this?
Brown, take a more fulsome view of this, and I believe we will be bringing a report to council in the next month that really speaks to a significant funding shortfall that we have in public health, both in respect to the current response, as well as presumably in recovery to restart other critical public health programs once we start moving out of the emergency response. So I think to the extent that our health inspectors have been heavily involved with together with vial enforcement and police partners in looking at the rollout of the vaccine certificate, I roll that up into just the overall amount of work that has really gone in to the COVID response, mass vaccination, and also what will be the restoring of other public health programs in our community.
Well, given how critical of a role public health is playing right now, we would never want you to be having a unfunded deficit where there are programs that could be at risk. And so I think the sooner we get that fulsome report for you, the better, so that we can do some advocacy on your behalf. And certainly in the first month of this implementation, we'll get a better sense of the type of additional responsibility that our municipal agencies will have. I also want to thank you for the work you've done with the Embassy Grand team. Really impressed how you've been able to break in, how public health was able to break into very diverse segments of our community. The fact that the communication is in multiple languages have been really effective. We had an appreciation event 2 weeks ago at Brampton City Hall for the team that was helping with this, and just blown away. And so I know a lot of the success stories don't get highlighted because everyone's so busy with the COVID response, but there has been some really creative ways to get vaccines in arms. And I want to thank public health for what you've been doing in the city of Brampton. And when it's appropriate, I will certainly bring forward a motion to make sure we can recoup some of the costs from the province, but maybe it'll be better to wait until you have that more fulsome response. And thank you again for your ongoing leadership. And one thing I would just suggest that would be helpful to have, Dr. Low, in your reports to council, and I know the hospital is sometimes hesitant to divulge this information, but I ask for it every week, and it's the number of people in ICU that are unvaccinated, and the numbers are staggering. I know when the numbers are very low, they're hesitant to release the data just because it could diminish privacy of individuals. If there's 4 people in ICU and there's 3 are unvaccinated, you could potentially be invading someone's privacy. But I just think it's such a compelling argument to get vaccinated when you see the hospital stats that by and large the people that are going to the hospital getting sick. We may have rising case numbers, but the people that end up in the hospital by and large are unvaccinated or partially vaccinated. So anything you can do, Dr. Low, to be able to gather more data, and if they can't do it on a local level, maybe on a regional level, because that way it's not as specific. I just think that's a really compelling argument. So if that's something you could look into, I think that would be helpful as we try to continue our communication.
If I may, Mr. Chair?
Yes.
So through the chair to Mayor Brown, absolutely. In fact, that was one of the focuses, or the foci, I should say, of one of our epidemiology summaries. Those epidemiology summaries still get posted on public, and I think we would obviously do a follow-up on that at some point. I agree at small numbers it's a bit of a challenge, but I think it was pretty compelling, the one that we put out, which looked at hospitalizations, I believe, through June and July, finding that 103 out of 101 people that were in hospital were individuals who had not yet received 2 doses of vaccine. And certainly, follow-up analyses in those weekly epi summaries will be made available. So it may not be on a week-by-week basis, but certainly on a regular basis, we will pull together those stats and do the analysis and release where we can. Thank you very much.
Thank you.
Thank you. And Mayor Brown, just to update the first point that you made, with kudos to yourself and again, Mayor Crombie and Mayor Thompson. This has been a regular ongoing file for us with regards to our federal and provincial partners, that they know the crisis we're in. We can't get past it without them. They've made very clear, from the Premier to the Prime Minister, who's again the Prime Minister, we will look after you. Don't worry about the funding. And Mayor Crombie, for example, talking about the problems that we're having with transit buses. Well, we don't run them at the region, but you do. Mayor Tory's done the same. So to be very clear, we at the region region, and I know the mayors as well, are looking at every funding envelope that exists, seeing if we qualify, and pressing the provincial and federal governments for anything in any way related to COVID. And we're continuing to ask for the money to keep flowing. And again, making it clear that this, as far as we're concerned, is the first tranche. We need much, much more to come. And also a shout out to Janice Baker, our CAO, who views items in that light as well. So rest assured, we're going after it in almost a forensic way to make sure anything that falls under the rubric of COVID, we want our partners at the provincial, federal level who have 90% of all the money to help us get through this. And that's going to be an ongoing thing. And I know you've been vigilant on that as well. So an ongoing program without question. Thank you. Councillor Kovac.
Thank you, and through you, Mr. Chair, just take a few minutes. Want to thank Dr. Lowe for being here today. Great haircut, you might see. I recently got one myself, which I think was long overdue. Thank you for your time today, for answering some of the really good, I think, points that were made, including the last one by Mayor Brown. I too would be interested to see what data could come to dispel and some of the ideas that people have around, the incoming potential passport and, the negative side effects, short and long term. I will say, in speaking with many people, young and old, various ethnocultural, religious, even educational backgrounds, I wouldn't necessarily put people in one group and say, okay, those who are uncomfortable, hesitant, they're all like this. And I think maybe it's easy to try to do that. And I think we saw a lot of that during this recent election. And what I appreciate with our Prime Minister getting reelected, he said something along the lines of a new dawn has come, and we're going to try to do away with the divisive rhetoric. So I would hope that most Canadians and Ontarians heard that and appreciated it, and will be expecting that as we go along. But just with regard to VAERS, and I know it's an American reporting system, but it's something that has been referenced by some Peel regional deputants. I think at the last meeting, I don't think anybody of the two spoke to it today, but what is it exactly, and should it be given any consideration, or should it flat out be tossed to the side? Because as I understand it, it's run jointly by the FDA and the CDC, and those are two credible entities that we hold in esteem. And maybe I'll just read very quickly. The Vaccine Adverse Event Reporting System is a United States program for vaccine safety, co-managed by the U.S. Centers for Disease Control and Prevention and the Food and Drug Administration. It's a post-marketing surveillance program collecting information about adverse events, possible harmful side effects that occur after administration of vaccines, to ascertain whether the risk-benefit ratio, and I guess you're always going to have that with vaccines, particularly with anything new, and we know mRNA technology is incredibly new, to ascertain whether the risk-benefit ratio is high enough to justify continued use of any particular vaccine. Based on what I've read, 182 million Americans have been vaccinated. That's a lot of people, and I believe it's double vaccinated. So that's about 55% of the population. So when we look at the VAERS reporting system, and I know people are looking at it, and you see, okay, post-vaccination, 80,000 urgent care, hospitalization, 60,000, 110,000 doctor office visits. And then you can break it down. You can go anaphylaxis, 5,900, Bell's palsy, 8,000. And some of these adverse side effects might be more coming out as a result of mRNA. it could be coming out more as a result of a viral vector like a Johnson & Johnson or AstraZeneca. But the one that really shocks people is the 14,925 deaths. And I think you made a great point last week or 2 weeks ago when one of
Councillor Kovac, Councillor, I appreciate your preamble, but I need you to come to a question. So why don't you tidy up your preamble and put the question?
I appreciate that. I appreciate that. Thank you very much. Maybe the question should be then, to what degree should we consider VAERS? How can it be helpful? And to your point, I think 2 weeks ago, it's difficult to substantiate. And I think that was an important thing that you said, despite the fact it takes 30 minutes to register a report. And how coincidental is it, I guess, if somebody does experience something and they're going to go through the trouble of reporting it?
Thank you. Dr. Lowe.
So through the chair to Councillor Kovac, thank you for your interest in VAERS. In Canada, we have a equivalent system called CAFIS, which is the Canadian Adverse Event Following Immunization Surveillance System. I think rather than talking about what VAERS can be, how much stake to put in, et cetera, first and most important thing is to describe what it is. So VAERS is an example of a passive reporting system, which basically allows healthcare professionals in the United States, even individuals, to basically fill out any adverse event that they have after an immunization. This does not mean that the adverse event was caused by the immunization. It's just that I had a shot and then 2 weeks later I had this, or 4 weeks later I had this. And this is because we take vaccine safety so seriously that we want to have any and all reports. It's a very sensitive, any and all reports of anything, so that you can actually look and see if it was caused by the vaccine. So in that sense, VAERS is, some of the data is, it could be spurious correlations. It may not even be related to the vaccine at all. You've highlighted very clearly, this is the largest vaccination rollout in history. And so with 182 million people, there are going to be people who just by nature of background will be befallen by, illness or even, mortal outcomes completely unrelated to the vaccine following the immunization. But VAERS exists so that we can have at least that report, so that if we are concerned about a potential signal, we can actually look into it and see if it is due to the vaccine or not. At this point in time, the only signals that have been identified are mild, limited time myocarditis in young individuals with mRNA vaccines, and certainly the thromboembolic challenges that are also still rare with AstraZeneca, which now continues to be used. And really, if you think about this, the number of reports that you're describing on hundreds of millions of people in the U.S., on billions of doses delivered around the world, and also recognizing that some of those may not even be related to the vaccine, I think the proof is in the pudding that the vaccines are incredibly safe and effective for the extent in which they've been used at this point in time.
Councillor Kovac, you have a supplemental question.
I do have a supplemental question just on that, and I thank you for that. That's a really good answer. It's just that I think some people might feel that is, you have absolutely nothing to worry about, not even completely safe. They are safe, and we should stand behind them. The efficacy rate is high. We have, Carolyn Parrish said 78% of the population in Canada double vaxxed. Fabulous. It's just, I think when people hear that, they say, okay, they're stubbornly refusing to accept that, yes, because everybody is different, their own bodily chemistry, how it might react to something foreign, a foreign agent, and as a result, contract an adverse side effect, and then the unknowns down the road. The hesitancy remains, and some people maybe need a little bit more time. So my supplemental question is this. Right now we have Pfizer and Moderna approved in Canada, and Johnson & Johnson and AstraZeneca approved, but in Ontario we've taken a bit of a pause. So right now we have really just an mRNA, and we know what that is, and we know that prior to the pandemic that was not for clinical use ever prescribed. So there may be some people who are just hesitant about that and what the adverse side effects are in relation to mRNA. For example, if you have a neurological disorder, are you more likely to have, I don't know, Bell's palsy? Should you get this vaccine? So my question is, there are others. Novavax is one. We have one that's from Maryland, an American biotech company, and Medicago, which is Canadian. It's a biotech company, Quebec City, plant-based virus-like particle vaccine uses plants as bioreactors to produce proteins as candidate vaccines and medications. I understand phase 3 trial will be completed in April of next year, and that Canada already has a deal to buy 20 million doses of the Medicago vaccine, which is Canadian, beautiful, and 52 million of Sanofi, which is French, from what I understand. But Canada does not have a deal with Novavax and some others that people have spoken about as they might like an alternative to an mRNA, and these are all alternatives. What would you say to that?
So through the chair to Councillor Kovac, procurement of vaccines is handled at the federal level, but I think it's really important for me to emphasize, though, that the mRNA technology is actually not new. It's been used previously for cancer therapies for quite some time before it was repurposed to actually support the current COVID-19 vaccinations through the products that are now available on the market. At this time, Health Canada has approved just 4 products for the use on the Canadian market, which are the Moderna, Pfizer, or rather they're now called Spikevax and Comirnaty, as well as AstraZeneca or Vaxzevria, as well as Johnson & Johnson, which is not currently being used at this time in Canada.
Councillor Kovacs, thank you.
Just a thank you. Thank you for your answers. Nobody wants to see a monopolization, though, of the vaccines. I'll leave you with that. Thank you.
John, thank you. Moving on, Councillor Sinclair.
Yes, Mr. Chairman, thank you. Through you to Dr. Loh. I notice the Ontario Human Rights Commission yesterday published a policy statement on COVID-19 vaccine mandates and proof of vaccine certificates. And we seem to have had maybe up to 5, at least, delegations from people very concerned about their rights concerning vaccines and certificates and so on. My question to you is, would you consider reviewing the policy statement and maybe posting a link on whatever part of the PO website has to direct people to look at this important statement that reviews rights and obligations? That's my question.
So through the chair to Councillor Sinclair, absolutely, we're happy to have a look at that statement, and should it be appropriate to help to disseminate it through our channels.
Great. Thank you, sir.
Yeah, very good idea, Ian. Good to see that come back at some point. Okay, that exhausts my list for questions of Dr. Loh. Dr. Loh, to you and your team once again, thank you very much. That brings me back to Councillor Sado, as promised, for the motion that came up, if we will, from the conversation. Councillor Sado, you have carriage of the motion. I'm going to go to you first to speak to the motion, but just asking the clerk, do we have something in writing or wording so that everybody can be clear on what is before the chair that Councillor Sado and Mayor Crombie would like before us? So maybe first through to the clerk, do you have what you need?
Thank you, Mr. Chair. The motion that we have at this point is that the chair, on behalf of Regional Council, write to the Premier requesting that legislation be passed to ban protests at hospitals and other healthcare sites, and that this resolution and letter be forwarded to Brampton, Caledon, and Mississauga for their information, as well as to all local MPPs.
Thank you. Councillor Sado, to your motion.
I'm fine with that wording, Mr. Chair, and I already spoke to it, so I don't need to say anything else. I just think we need to take a position to protect our healthcare workers.
I go to my list. Mayor Brown.
Just to say, I'm happy, if you want to have all 3 mayors seconded as well, happy to do so. I think it's important to show we support our healthcare workers and protect them from some of the type of protests we've seen elsewhere.
Very good, as we've done on similar motions of this gravity on the file. Absolutely, the chair will ensure that that's the case. Councillor Kovac.
Thank you, Mr. Chair. Just to Councillor Sado, I would wonder if you would want to include somewhere within like a window and maybe to specify that it would be just during the pandemic. I mean, what I've seen equally obnoxiousness, obtrusiveness, and I don't think it's good for anybody. As you had rightly pointed out. I think it also does a disservice to maybe anybody who is out there who is hesitant or whatever it might be to then unfortunately be lumped into the same category as an aggressive kind of a person like that, that's mean-spirited and rude and the whole bit, right? Lifelong liberal, I'm talking about myself, labor background, proud of it. Protesting, this would be a difficult one for me to go against, you know, whether it's in the public square, it's take it to the streets, man. But I get as well your points, so it's a little bit difficult for me. I'd like a little bit more time, but I just wanted to know if you would consider adding that.
Councillor Sato?
You know, I don't think it's appropriate anytime, Councillor Kovac, for people to be protesting in front of a hospital, quite frankly. But I really don't think we need to put a time frame on this. I mean, I think right now it's very clear that the people who are protesting because of COVID legislation, which has nothing to do with the hospitals and other things. But I prefer not. I mean, you know, if they stop protesting, then it's a moot point, and let the province put the timeline on it if they wish. It's going to be their legislation, not ours. I think just a generic request is all we need from Regional Council.
Thank you. Mayor Crombie.
I have been speaking out on this as well, and I thank Councillor Sato for drafting it, for moving the motion. I find this action deplorable, and the province of Quebec went a little further and banned protests, COVID protests, anti-vax protests at schools as well. So, Councillor Sato, should we include schools as well as hospitals?
Yeah, Mr. Chair, if I could jump in there, I wasn't aware they'd included schools, and you know, maybe to appease Councillor Kovac, we could add in the words, as Mayor Crombie's just said, anti-COVID or whatever wording would you just mentioned there, which doesn't set a timeline, but it's very specific what they're protesting against, and I'm perfectly fine adding schools.
Anti-COVID protests, I think I said.
Yeah.
Okay, that wording to be included accordingly. Mayor Crombie, anything further? No, thank you, Bonnie. Mayor Thompson.
Thank you. And I know the small countryside mayors feel very similar to what the large urban mayors are doing as well. And absolutely, it's about protecting the most vulnerable, which are the people in the hospital and our children. And to me, I think it makes perfect sense. We need to ask the province to step up and do the right thing. Everybody has the right to protest, but not there. Where we got life in jeopardy, we need full access for people to be able to get the care when they're most vulnerable. And this is not the place to have the demonstrations. Thank you.
Thank you. The only other thought that I would add, because it brings back to mind, some of you may recall the name Chris Stockwell, who was a politician and then was the Speaker of the Legislature at Queen's Park. And during times of protest, he had a great line. He said, "Come and protest all you want. It's your democratic right. Just don't wreck the place." And what I would add to that is, and don't harm the healthcare workers who are trying to save your lives and your loved ones. I think that's our message, and I think it's totally appropriate. So good on you, Councillor Sato, and to the mayors for being on this file, but I think the motion is timely. That concludes all my speakers. A recorded vote was asked. Was there somebody? Oh, Councillor Dillon, I didn't see. Any other speakers? Councillor Dillon.
Sorry, can you just go over what the motion is again? Just want to hear it one more time.
Very good, Madam Clerk.
That the chair, on behalf of Regional Council, write to the Premier requesting legislation be passed to ban protests related to COVID or vaccines at hospitals and other healthcare sites and schools, and that the resolution be sent to Brampton, Caledon, and Mississauga for their information, and to all local MPPs.
Sorry, and I can't support it, and I'll tell you why. I think it's hypocritical for a government to curb people's right to protest. Meanwhile, it's, from what people are telling me, it's been do as I say, not as I do. And I'm not an anti-vaxxer. 100%, I'm a staunch proponent of people who are eligible to get the vaccine. But I think when government starts to take these footsteps towards taking people's rights away, I think it becomes a problem. if it wasn't for the hypocrisy of, all levels of government, I could even support it. But I've seen protests over the last 2 years when politically beneficial be allowed and supported, but when not politically beneficial, it's been criticized. We've seen politicians themselves break the rules, yet preach and scold those who don't follow the rules. And I'm speaking from all levels of government. We recently saw a political rally that broke every COVID restriction. And a mayor in the States who told people who criticized her, hey, don't be the fun police because I'm enjoying myself. Again, I'm a staunch proponent. I say get the vaccine. I agreed with many of the province's emergency measures. But how can we ignore people who are indeed frustrated at their governments and are worried about government overreach and skeptical at what could be next? They're seeing countries like Australia who are getting worried about their freedoms taken away. And I think everybody here, we all live with privilege, but we're not aware of what it's like to have your privileges, freedoms, and rights taken away. Another reason why people are frustrated at their governments is because at one point, give an example, the government said, take AstraZeneca. Then they said, no, don't take it. They said, mix the vaccines. Then they said, don't mix the vaccine. They said, mask, no. And then they said, no, double mask. Then they said, get the vax to protect yourself. Now they're saying, get it to protect the vaccinated. Again, where there's a protest that's politically convenient, it's been praised. But if it's not, it's been labeled as a super spreader. So people are upset. They're not robust. They're not going to trust every single thing that the government says. I think if you look back at history, government has not always been right. But when the government starts chiding people who criticize them, I think that's extremely worrisome. And at this point, to chastise them and take their rights away, I can't support that. I'd prefer there be some other accommodation be made where they can protest somewhere else. But to tell our residents we're right and you're wrong, you can't protest at all. Your views we don't agree with, and to put them down, I cannot support that at all. If there's another accommodation, I could support it, but there's too many people that are upset, and I've seen in the media, and I've seen just through discussions that their opinions are shot down, and I don't think that's right. We live in a democracy. If you have an opinion, no matter how stupid it is, that's your right, and I support your right to have a stupid opinion, just like I support your right to have a valid opinion, one that I agree with, and so. For that reason, I can't support this just because it's too general, too broad.
Councillor Singh, thank you. Mayor Crombie.
I think I may have a solution.
That's Councillor Dillon, not Singh.
Oh, my apologies, Councillor Dillon. Thank you.
I may have a solution. Just to Councillor Dillon, I mean, in my view, these protesters are infringing on patients' rights to receive life-saving care and treatment, and I think that supersedes your right to protest. That's just my view. But what if we put in within 50 meters, so they can protest, but in the parking lot within 50 meters, and not a block access to entrances or ambulance routes? And at the same time, maybe we can get the staff looking at this, but since we banned smoking from within 50 feet of a municipal building, can we do the same, ban protests municipally as well? Can this be a municipal bylaw?
Yeah. Mayor Crombie, before I go to staff, perhaps, and to Councillor Dillon's point, perhaps I missed something in the chair. And what I thought we were saying is exactly what you've described, this kind of conduct in front of hospitals. I didn't think we were saying we were banning protests. This is just at that epicenter where it's just perhaps you can. I understood. I don't think we're saying you can't protest anymore, but you might like to speak to that, and perhaps Councillor Sato, unless I've misunderstood.
No, you're absolutely correct. We just don't want the entrances to hospitals or ambulance bays blocked. So no, and if it helps Councillor Dillon, we can say within 50 feet of those areas. But the point is, we don't want protests at hospitals that are providing life-saving care and treatment to patients. all patients, including COVID patients. And I think schools as well. But if it helps Councillor Dillon and Councillor Kovac or whomever else, we can say within a certain distance, that may help. And then I would be interested in our staff's view on whether this could be a municipal or regional bylaw as well, since we did ban smoking within, 10 meters.
Yeah, Bonnie, well put. This morning papers, Mayor Nenshi was proposing to do just that. I'm sure you saw it as well. And I had the same question, but I will go to the mover of the motion on those points. Councillor Sato.
So, I mean, I don't think we should be playing around with distances right now. I think you just start getting very convoluted and let the province decide what the distance should be. But if council wishes to put a boundary in, I don't think they should be allowed to protest on the property. So 50 meters would probably, that's only a couple hundred feet. That would allow protesting in the parking lot, and you're still going to be blocking people who are going there for health care, and the staff who are going to work. So I would prefer that we leave a distance out, because it's going to be different on all properties. Some you may be able to, be outside if you're 50 meters or 150 feet. Some you're going to have 100. So putting an arbitrary number in there, I don't think it's needed. I think we just say that we want the Premier to ban protests in front of hospitals and in front of schools, or at hospitals and at schools. And just let it work out for each individual location. So I prefer just to leave it as it is.
And Councillor Sato, to be explicitly clear, just at those venues, I don't want to vote. You still believe people have the right to protest in the appropriate manner?
Absolutely.
Right.
The motion only speaks to those particular venues. And that's what our responsibility is as the Board of Public Health here at the region.
Very good. I'm glad that was made clear. It was never a conversation beyond that in all the conversations we've ever had, certainly. But I think the point needs to be made clear, because Councillor Dillon raises a fine point, and it should be made explicitly clear. That concludes my list of speakers. A recorded vote has been asked for. Madam Clerk, over to you.
Thank you, Mr. Chair. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Absolutely. Thank you.
Mayor Crombie in favor. Councillor Demurla. Councillor Demurla. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
No.
Councillor Dillon opposed. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Early.
Very happy to support this. Thank you.
Councillor Early in favor. Councillor Kovac.
I will respectfully abstain.
Abstain. Councillor Kovac abstains. Thank you. Councillor Mahoney.
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden.
In favor.
Councillor McFadden in favor. Councillor Medeiros.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes, in favor.
Councillor Vicente in favor. It carries. Thank you.
Madam Clerk, it's Councillor
Yes.
Dillon. I was unaware that you're able to abstain. And I think, some of the suggestions that Mayor Crombie had made, I could have supported. but if I can, I prefer to change my vote to abstain.
I've changed your vote to abstain.
To abstain, well, abstain from the vote, rather.
Yes.
Thank you.
Mayor Crombie, that vote is carried. Mayor Crombie.
Isn't an abstention a vote in the negative in any case?
Yes, I believe that's correct.
That is correct. It is counted in the negative, but it is recorded as an abstention.
The record shows you abstained, but your vote is counted in the negative. Absolutely correct, Mayor Crombie. Council.
And then one more thing, has staff had the opportunity to check whether it would be, we could do so at the regional level or at the city level as well?
I'll come back to that. Good point, because I have Councillor Parrish perhaps on this. Councillor Parrish.
Yeah, I would assume we can change that at policy and procedures. I think people should always have the option of being able to abstain and taking themselves out of the count if they feel strongly. So can I refer that to policy and procedures?
Yeah, I think that's a good idea because I've had the same thought myself, Councillor Parrish. Appropriately so, taken as direction that it be referred back. So that vote has been concluded with the 2 abstentions under our policy. If staff is prepared, if someone can answer that question that Mayor Crombie has raised with regards to jurisdictions like Mayor Nenchi's that are saying we as the locality or as the regional government, we're going to pass our own policy on the matter. Can anybody speak to that and give us an insight? I see our solicitor, Patricia Kaza. Patricia.
Thank you very much, Chair Nika. I think what I would like to do is take that back. It's an interesting suggestion. The reference to the smoking bylaw, really those bylaws are passed pursuant to specific legislation. So I would like to take that back and consider how the municipal act might be used in reference to a situation like this. So please let me have the opportunity to do that, and we can report back to council on the matter.
Very good. Totally appropriate to come back. Bonnie, did you have something for Mayor Crombie?
Comment on that issue, and that was, I was just trying to check whether province of Quebec banned protests within 50 meters, but I believe there are protests banned from 50 meters within an abortion clinic as well. So that 50-meter rule seems to be in place in various places. So if they want to look into that, but I'd be happy to move any municipal bylaw or regional bylaw that comes back banning for ourselves banning protests at hospitals.
So we're going to wait. Well put. We're going to wait for that confirmation in a report that I assume will come back in a very timely manner, and more to follow on that. Okay, excellent discussion all. Thank you very much. That concludes those matters. That takes us to our final staff presentation, and a big one, dare I say. TransHelp celebrates 40 years of service. We have a presentation from Mark Castro, our Director of TransHelp. Mark, welcome.
Thank you, and good morning, Chair Unica and members of Regional Council. Thank you for giving me a few minutes this morning to speak about the TransHelp program. As part of my presentation this morning, I'll provide an update on how we're celebrating TransHelp's 40th anniversary of this year, also a quick update on TransHelp's COVID response, and finally, an update on some key priorities for the program once we find ourselves in a post-pandemic world. Next slide, please. So definitely, certainly a big milestone for the program this year as we celebrate 40 years of service to the Peel community. Our theme is one of thank you and appreciation to our employees, our clients, their caregivers, and of course, our service partners. We held a special virtual celebration with our staff earlier this week, where we shared passenger testimonials, a photo slideshow taking them down memory lane, and even played some TransHelp trivia. Our goal was to make staff feel appreciated, and we think under the circumstances, it was a successful event. In addition, we've wrapped 2 TransHelp buses in a special 40th anniversary thank you message. They're in the community now, providing service to our passengers. And a 40th anniversary webpage was launched featuring photos, historical milestones, and heartfelt testimonials from our passengers. I will share that website with you tomorrow and in an email follow-up to you. Tomorrow I'll follow up, like I said, with an email to Regional Council sharing some images and messages that you can also share on your social media platforms to help us mark the occasion. Now I'd like to share a short sample of some of the testimonial videos we did receive from some of our members of the TransHelp Advisory Committee who are also passengers. Next slide, please.
Congratulations, TransHelp, on your 40th anniversary. I started using TransHelp in 1981, and your service means so much to me. Prior to this, to get back and forth to work, I used Mississauga Transit, taxis, and people from work would also help me when they could. I have cerebral palsy and use 2 canes to walk. Climbing up bus stairs was not easy. When I heard about TransHelp, I signed up. I could depend on the service to get me to work every day safely, no matter what the weather. In 2014, after 40 years of service with World Vision, I decided to retire. I know that I could have never reached that milestone had it not been for your help and support. Thank you. As I live on my own, I depend on TransHelp for almost all of my transportation needs, medical appointments, shopping, going to church, and just having fun. Thank you, TransHelp, for helping me to have a more independent life.
Hi, my name is Azhar Kareem, and I'm a client of TransHelp. As a legally blind person, I've been using TransHelp for the last few years. It's a wonderful service which is making a huge difference in the lives of people with disabilities. I want to congratulate TransHelp team on the occasion of 40th anniversary of TransHelp, and I take this opportunity to thank the entire team of TransHelp, the management, the frontline workers, people in the back offices. They are all doing commendable work. Thank you so much, and may God bless you.
Dear TransHelp, you are one of the cornerstones that helped me to achieve my dreams. I was able to plan and pursue my professional growth as you're there to drive me to places that my job required. Most importantly, you helped me to keep my vows and be dedicated to my family, for better, for worse, in sickness and in health. Being a member of TransHelp Advisory Committee made me even more aware of your concerted efforts to design, redesign, and improve the service performance. On your anniversary, I would like to express my gratitude for the role that you have been playing in my life. My thanks are due to not only the drivers and CSRs, but also to the entire team and third parties that are not visible to us, the customers. Happy anniversary, TransHelp family.
Next slide, please. So those testimonials always help to confirm and validate why we do what we do, and staff always appreciate hearing those. The evolution of the TransHelp program over the last 4 decades is actually quite remarkable, and although there's more for us to do, here are some examples of how far the program has come. So in the early days, eligibility was limited to only residents with physical disabilities. Today it includes all disability types. TransHelp started with just 13 staff. 8 of those were bus drivers, serving under 200 residents. Today we serve over 10,000 residents with a staff of just over 100. The original fleet consisted of just 6 modified vehicles, including a couple of station wagons, believe it or not. Today we have over 70 regionally owned buses plus hundreds of contracted vehicles that help to deliver the service. Service is now offered 7 days a week, 19 hours a day, including on holidays. In the early days, clients had to book a minimum of 2 weeks in advance just to have a chance at getting a ride. Today, just 24 hours notice is required to guarantee a trip. And just a couple of years ago, we introduced some limited same-day service, and we continue to plan on improving our on-demand offering in the future. Finally, believe it or not, as recently as just 15 years ago, it took 4 to 6 months for a resident to actually access TransHelp service. A prospective applicant would need to wait a minimum of 4 months to get an assessment just so their application could be considered. Today, the application process is much more streamlined. Applications are processed in less than 2 weeks, and under certain compassionate grounds, we'll process the application in 24 hours so people can start using the service right away. All of these changes to reflect the program's key commitment of removing barriers for our residents with disabilities and being there for them in their greatest time of need. Next slide, please. So here's a quick look at some key stats that represent the impact TransHelp has had on the Peel community and how great the need is for services like this. So over the past 2 decades, trip demand is up 499%. The number of passengers is up 567%. Application volumes are up 250%. And the number of kilometers we travel annually is up 216%. So the service continues to be delivered using a mix of regionally owned buses and contract vendors. By 2019, 70% of the service was being delivered using third-party vendors. And although demand is currently down due to the pandemic, it's expected that demand will continue to grow as the population ages. We also expect the service delivery model we use today will continue to be the most sustainable model to deliver service going forward. Passengers today enjoy more regular and convenient service thanks to the AODA Act, as well as the Accessible Transportation Master Plan, which many of you endorsed just a few years ago. Next slide, please. Next, I just want to take a quick moment to acknowledge the efforts made by the TransHelp team over the past 18 months to support the region's pandemic response. We've had 19 staff redeployed over the course of the pandemic, with 6 still supporting some key areas of the corporation. We've provided 2,000 plus vaccination trips for residents with transportation barriers. And although this may seem like a small number compared to the overall number of vaccines we've administered in Peel, keep in mind that these are some of the most vulnerable in our community who otherwise may not have had an opportunity to get a vaccine. And shortly after the pandemic was declared, TransHelp mobilized to set up a special COVID transportation service, one of just a handful of agencies in Ontario to do so. To date, we've assisted 1,700 plus residents suspected or confirmed as having COVID get to testing in isolation centers, many of them residents in our shelter system. The numbers may not be large, however, the impact the response has had has been tremendous. And I wanted to publicly acknowledge the staff.
Even though I'm in a council meeting, I took the call.
Everybody turn off your microphones, please. Otherwise, only the speaker, please. Thank you. Carry on, Mark.
Thank you. I just wanted to publicly acknowledge the staff and let them know how proud I am of their efforts. Next slide, please. The pandemic continues to have impacts on the program, and to put things in perspective, shortly after COVID came to us in March 2020, TransHelp demand fell from an average of 2,400 trips a day to approximately 500 a day. We've since seen a bit of a rebound, with daily demand now in the range of about 1,000 trips a day. Although the pandemic has resulted in reduced trips, the need for TransHelp is expected to continue to grow. We'll continue to monitor the impacts of COVID on ridership and adjust service levels responsibly if required. Although we expect to return to pre-pandemic ridership at some point in the future, the timing remains uncertain. In the meantime, TransHelp will continue meeting the needs of the community while keeping certain health and safety precautions in place to protect both passengers and employees. During the pandemic, we've taken the opportunity to review activities once delivered in person and made changes to deliver them virtually. One example I'd like to share is our eligibility assessments. The old practice was a client was required to attend an in-person meeting at the TransHelp office with a medical consultant. We were able to shift the entire process online virtually, saving about $50,000 a year and making access to the program much more efficient. So we continue to review other similar activities to find similar efficiencies and opportunities where improvements to the passenger experience can be achieved. Next slide, please. And finally, a quick look ahead at some key priorities for the program post-pandemic. Staff will continue to monitor trip demand, as I mentioned, and revise service levels where necessary to best meet the needs of residents in a financially responsible manner. The Accessible Transportation Master Plan continues to be the foundational roadmap in TransHelp's modernization strategy and work plan. Given the pandemic, however, and the pausing of many activities, we believe an update to that plan is necessary at this time. We want to ensure that any longer-term impacts from COVID are considered as part of the TransHelp strategic framework. So we are planning to complete a mini review in 2022, at which point I'll be happy to return to Council to provide updates on the outcome of that review. Over the next 3 to 5 years, we'll be guided by 3 key outcomes when we operate the business: creating opportunities for integration with our transit partners, leading to a more seamless travel experience for all, disability or not; increasing and enhancing our online presence and leveraging all the technology that's available to ensure that we're operating as efficiently as we can; And lastly, and most importantly, I would argue, improving the passenger experience, which will and should guide all our decisions. Lastly, before I conclude, I wanted to let Council know that we're also exploring a possible TransHelp electric bus pilot for 2022. We have a unique opportunity to leverage significant external funding that's available and at the same time demonstrate some innovation and leadership in this space. So if successful, we would be one of just a small group of specialized transit services in Canada exploring electric buses with their fleet. And of course, at the same time, we would be contributing to the region's reduction of greenhouse gases, however small or big the impact may be. Next slide, please. This concludes my presentation, and I'll end by saying this. The evolution of TransHelp over the past 40 years has been a collaboration of community partners, internal and external stakeholders, all focused on removing barriers for individuals with disabilities. I want to take this opportunity to thank employees, passengers, our vendors, advisory committee members, community partners, and regional council members, past and present, who have supported this vital service. Thank you for your time and attention, and I'd be happy to take any questions if there are any. Thank you.
And there are several. Well done, Mark, to you and the team. First up, Councillor Paleshi.
Thank you very much, Mr. Chair. Mr. Chair, for the majority of people that travel on our roads, TransHelp is just another white bus on the road. But for the people that are around this virtual table, it's not just a bus, it's a smile on our face because we've heard firsthand how TransHelp has touched the lives and been provided opportunity for people that use this service. So today, Mr. Chair, I know that if we weren't virtual, if we were all in chambers, I think we'd be standing and applauding the 40 years of work and dedication that the TransHelp team have provided the residents of the Region of Peel. Thank you for allowing me this opportunity to thank all of the TransHelp team members for the outstanding work that they've done over the last 40 years. Thank you, Mr. Chair.
Well said. Councillor Dasco.
Thank you through the chair. And Mark, really good presentation. The video, I think, really just kind of puts everything in context as well, just in terms of how people feel about the program. And I've got to say that before the pandemic, I had an opportunity to do a ride along, and you don't fully appreciate, in my opinion, what the program truly does and what it means to so many people until you actually see it. It's there's a relationship also that happens between the drivers and those that are using the service, and it truly is. It's remarkable. And so all through the pandemic, you know, it's truly just heroic efforts really by our drivers because you know that the care is going in to keep everybody safe. So a big congratulations for this big milestone. I've got one question, and that's just, have you found, because I see that ridership is down about 60%, have you found that ridership has been moving up, or has it stagnated? And I'm just curious to see where those numbers might be going.
Thank you. Through you, Mr. Chair, to Councillor Dasco. Certainly, so since about June, July, when the province's reopening framework began, we've seen a steady month over month, and September seems to be trending that way as well. So now still far off from pre-pandemic levels. To put it in perspective, you know, we were doing 50, 60,000 trips a month. We're now averaging about 23 to 24. But in June, that number was about 17,000 a month. So certainly going up, not at the pace that is going to take us to pre-pandemic levels anytime soon, but it is trending up over the last 5 to 6 months.
Great to hear. And again, to everybody that's from manning or however we call it these days, the phones, taking all the calls for people that do need the service, to all the drivers and everybody associated with the program. Just a big congratulations and wishing everybody all the best on another 40 successful years.
Thank you. Mayor Crombie.
Really, I just thought I would be remiss if I didn't lend my voice to all of us who are praising TransHelp today on your 40th anniversary. Thank you for what you do each and every day, particularly assisting our most vulnerable residents who count on you. And the drivers go above and beyond to help these people every time I hear about it. So you've picked the right people to serve at TransHelp, and thank you. Their personalities really mesh with helping people who are so vulnerable. And we thank you, and we know how exponentially you've grown, and you do an incredible job. So thank you very much.
Thank you. Mayor Thompson.
Yes, and Mark, a wonderful job. You've been a terrific champion in this role. What I have to say to you and your team, you listen, you care. The slogan on your bus should be saying, we listen, we care. That's what's made your 46 or 40 years of success be. The measures that you have accomplished is huge. I want to thank all of your team. You found efficiencies, you found ways to deliver, understood the disabilities, and overcome those barriers by making it quite simple. You have led the way to find efficiencies, and you're a model to the region appeal to all of your team. And I'm echoing, and I think Councillor Pleshy really hit it off from the very start. But the relationship that I've had with you and your team and helping our residents here in Caledon to move around Peel and other areas, thank you. And the reason for your 40-year success is because you listen, you care, and on your slogan, I do believe, we listen, we care. That's your success. And it is. We're proud to see what you do for our community. And the electric buses, another great step going forward. Goes to show that you're really on the ball. Fantastic job that you're doing with your team. Congratulations from Caledon and from everyone. We really appreciate this. Thank you.
Thank you. Councillor Groves.
Thank you, Mr. Chair. I too would like to thank Mark and his team for all the hard work that they've put into TransHelp. And I know, Mark, we've been through some changes with TransHelp, and the transition, sometimes they were a little difficult because it was just a matter, people don't like changes most of the time. But the way that you and your team handled those transitions and help those individuals to transition through the changes that came down from the province of Ontario. You did a fantastic job, and I know that some of the residents who had accessibility issues and they were a little nervous, you truly helped them through those challenges and get them through those changes quite nicely. I also want to thank you for the funding that you also provide to Caledon Community Services for our residents here in Caledon who use the Caledon Community Services bus. You've been great working with Monty Laskin and his team at Caledon Community Services in providing the service. And I think it was one of the previous speakers who said, sometimes these seniors or these individuals taking the bus, sometimes they're a little nervous. I can tell you that my mom was a TransHelp user, and the first time she had to take it, she was very upset. Not so much upset, but she was very nervous because she had accessibility issues. But I will tell you that the drivers that drive those buses, they are absolutely amazing. And we need to thank them as well. The service that they deliver and the comfort that they give these riders, and knowing that, if you don't have to worry about falling, we'll help you get from your door to the hospital or to the doctors or to home or whatever it is. So we also need to acknowledge those drivers, because there's a relationship there that's built between the riders and those drivers. And I will tell you that most of those drivers, I would say, they do a lot for those passengers who use the service. So again, thank you to you and your team, Mark, and please give our thanks to the drivers as well for the service that they also provide. Thank you.
Thank you. Councillor Kovac.
Thank you, and through you, Mr. Chair, thank you, Mark, for being here today. And I just say that it's a pleasure to serve on the Accessibility Transportation Master Plan Advisory Working Group, and with members Councillor Groves and Councillor Vicente, and the work that we do on that working group, but also to those members who are devoted on the Regional Accessibility Advisory Committee, and I believe that's Councillor Mahoney and Councillor Groves, Councillor Fortini, Councillor Sinclair, and then at the City of Mississauga, Councillor Sado, and Councillor Mahoney as well for the work that they do in that kind of the synergy that I believe is there as well between the various committees and working groups. I couldn't help but hear earlier you had mentioned the review that you are undertaking, and so if there are anything you need at any point, reach out. I would wonder whether members of TransHelp could potentially be surveyed, and I know it's very momentous. It's 40 years. It's great. It's been 40 years. Maybe a bit, what would be the word? Ambiguous. Congratulations.
Mark, please, yes.
Yeah, through you, Mr. Chair. Yeah, Councillor Kovac, thanks for the comments. In fact, so there's a couple of things that we're working on that I'll mention quickly. So we typically do an annual sort of passenger satisfaction survey, and we had the opportunity to throw in some additional questions just to get some feedback. We're in the process of actually making that an automated process and doing it a bit more frequently, so 2-3 times a year. So we'll have some unique opportunities to actually get some specific feedback related to branding and how the name and the buses are marketed. That is on the work plan in terms of the overall TransHelp branding and marketing, including looking at the name itself as part of our work plan. So that is not going to happen this year, but I believe we'll start looking at that next year. So and just thank you for your work on the ATMP advisory group. I'm hoping to come in the new year with some key points and decisions that I'd like some input from the group on. So thank you for those thoughts.
Thank you. Councillor Starr.
Thank you. And Mark, I just want to say to all of you, I'm not going to repeat all the great kudos you've got, but it's a wonderful service. And I think some of you know during some bad years for my wife before she passed, she had to use TransHelp. And I want to reiterate what Councillor Groves said. The people that helped her were compassionate. As a matter of fact, I have to tell you a little story. The first time she ever was invited to go on the bus, she was violent. And the staff were compassionate. They called me and said, I think we've got a solution. Why don't you have the caregiver come with her for the first few times? And that's what happened. And then within 3, 4, 5 days, she was used to the people on the bus. She was used to the system. And it just, I think it's the interaction that you provided, Mark, and the people when they realize there are situations that have to be treated differently. And every person that does use and every client that you do have are different. So that's what makes the job sometimes, I think, even more difficult. But with the understanding and with the training and with the compassion that they have, understand that. We think it's difficult to deal with these people, and it is, but you folks should be celebrating the fact that you do that job day in, day out. And I can recall from someone else 20 years ago, yes, there was a 10-day waiting period. It wasn't for my family, it was for another good friend of ours. And they used to complain, why do I have to go a week ahead, 10 days ahead? And now, of course, it's 24 hour or less turnaround. And I haven't certainly I know that we've had complaints in the back, but these complaints or concerns, let's not say complaints, concerns, they're always handled by you folks in the best fashion possible. So keep up the good work, and certainly I think the council is unanimous in the fact that you do good work, and hopefully some of your staff is watching this, and please pass it on, and think about giving them something, something small, and it's from all of us, including yourself. So thanks again. Keep up the good work.
Thank you. Councillor Sato.
Thank you, Mr. Chair. And, I think Councillor Starr's experience with his wonderful wife on TransHelp says it all. And that's the type of feedback that I hear all the time from the Accessibility Committee in Mississauga. And when I sat on the region's Accessibility Committee, I heard it from the members, the citizen members of the committee there as well, many of whom use TransHelp to get to the meetings. And, we really can't say enough about how important this type of service is. We added on full accessibility on our transit buses, and we made all of our transit stops accessible. We made all of our buses accessible, and that's fine for the people that can get to the bus stop. But for those who can, or that there's a close bus stop at the other end to where they're going, and that's a very valuable service. But for those who need the door-to-door accessible transit, TransHelp is, other than a taxi cab, TransHelp is the service that provides that. And as Mayor Crombie said, these are some of our most vulnerable citizens, and they need to get to work. They need to get to doctor's appointments. And even more importantly, they need to get out and live their lives. And previously, I think one of the other councillors mentioned that, we've increased the service so you don't have to book as far ahead, because that was a complaint that I've heard over the years constantly from the accessibility advisory committees, that you can't plan your life necessarily 2 to 3 days or 4 days in advance, and it was not giving the same accessibility to life that that able-bodied residents would have. So, the changes that we've made in TransHelp have been good ones. And Mark, that the members of the Accessibility Committee are never shy about giving their feedback. And I know that Councillor Mahoney sits on the city one with me, and he's found out that that feedback comes, and now he's on the region one, and I'm sure he hears it there as well. But I really want to congratulate you and all of the staff that provide this very, very important and excellent service to our citizens in the region of Peel. And it's hard to believe it's been 40 years, but I love the idea that you're looking at electric buses. And I think Councillor Kovac and his comment about, a refresher on the name change. And I'm sure if you go to both committees, or at least I'm sure I think Brandon and Caledon have committees as well, go to the committees, you're going to get tons of ideas. And I know that the citizens love to get engaged in that, because it's a service they use and it's very important to them. So congratulations to all of the staff, and thank you.
Thank you. Councillor Early.
Thank you. Well, congratulations first. I had to tag on. I know everyone's spoken very well, but on a personal note from my family, a big thanks. 7 years ago, my mom lost her leg and ended up in a wheelchair. And you can imagine a woman in her 80s transferring from chair to car became very difficult. A nurse gave me the application for TransHelp, and literally it saved our lives. All the appointments to the hospital, all the appointments to clinics, to doctors, and even coming here. It was just brilliant. She was able to navigate through those 7 years years. Last October was the last time she got to come here before passing during COVID, and it was the neatest thing. The driver came to the laneway, Ursula, as if he was just like our long lost friend. And, you know, she says, "Oh, it's you. You've come to pick me up." And it was just a beautiful relationship. Additionally, as a board member on Caledon Community Services, I am fully aware of the collaborative efforts between your organization and our organization and what it's doing for the residents of Caledon. So I had to at least chime in after all the stream of councillors, but to say thank you very, very much from our family. Thank you from our Caledon residents, and congratulations to you and your team.
Thank you. Councillor Vicente.
Through you, Chair. Mark, congratulations to you and to your team. I know that from my perspective, I don't have a personal story to share, but both Councillor Santos and I have heard many testimonials from our residents who truly appreciate the service and who value your team's flexibility in dealing with their very complicated schedules and situations. So I just want to join the chorus today and to say congratulations to you and for delivering excellent service to the community. Thank you.
Thank you. If I may, as chair, just what I could add is this. First of all, it's been said, but thank you to all the members over the years that have sat on our Accessibility Advisory Committee. We wouldn't be here without them. But I would venture to say as chair, with housing as a close second, I'm very proud of what this council's done over the years on housing and catching up on that file. But dare I say, from when I started 33 years ago to today, and where TransHelp was 40 years ago, 30 years ago to today, I don't know of any file where we've made greater strides. Still a long way to go. Our friends that require the service tell us that and give us very good constructive criticism. But from where this thing started out, as Councillor Starr says, 7 to 10 days, and here's your window, and you've got to get on it. Oh my God, as I say, we'd still like a tighter service, and we're going to continue to fund it and keep moving forward. But this is a marvelous success story. The second thing I want to tell you is, again, in those 33 years, I heard it all, but I rarely hear something that takes my breath away and brings a tear to my eyes. I hope you were listening carefully when one of our advisory members said, I wrote it down. I paraphrased it. Listen, if you need a reason to do the jobs you do, my colleagues, because it's normally boring. You make sure the garbage gets picked up. You make sure somebody's toilet works. You make sure, because we provide the sewer service, you make sure they get water. You make sure the roads get plowed. Kind of boring, mundane stuff. Here's what she just said to us. She wanted to thank us for the service we provide because it has allowed her to maintain and fulfill my vows to my family. That's what she just said. Allowed me to maintain and fulfill my vows to my family. Perhaps her spouse, her children, her mother, this has allowed her to be grateful, gracious, empathetic to others. I got to tell you, it makes the job worth doing, and you should all be very, very, that's why we get up in the morning and do what we do, so that somebody can tell us we helped them be better for other people in the most selfless way possible. So real kudos to her, and thanks for making today a special day for all of us. And that's all because of our TransHelp staff and Mark, you as well. So a red letter day. Thank you very, very much to all, and more good work to come on the file. Okay, with that, we conclude the formal elements of our agenda. We are on to what was held under consent. The first item that I have is 13.1, held by Councillor Parrish, Appeal 2051 Official Plan Review and Municipal Comprehensive Review Draft Amendment, requirement to hold a statutory open houses and public meetings. Councillor Parrish.
Yes, thank you very much, Chair Unica. I held this because I want to bring a few things to people's attention. I know we all read these carefully, but being a former teacher, I like to review. I want to start by thanking Commissioner Keely Dedman, who came in probably 2/3 of the way through this horrendous process, and she's doing a fabulous job. I want to thank Adrian Smith, who's shepherded it through all the way, and the core committee, as well as the frequent flyers who aren't on the committee and they come occasionally, or some of them come every single time, like Councillor Ian. Sinclair, sorry. I do that to you every time. I want to note that on Tuesday, October 26th and Thursday, October 28th, There will be public meetings, and hopefully we will all be able to attend some of them and listen to what people have to say. They will be after the council workshop on the 21st of October. At that workshop, we will be in receipt of a reduced, concise report with mapping and modeling that's easy for us to follow as to the effects of, particularly in Brampton and Caledon on infill, Brampton and Mississauga, and in Caledon on the areas that are going to be developed. We're hoping that the committee and council will see the report in enough time to really understand it. Through this report, you see several locations where we're reminded by staff that if we don't complete on time, our good friends at Queen's Park can come in and take over the process from us, and we don't want that to happen. Several regions have refused to do it during COVID because they can't have open public meetings, and I fear for them because the process, if it's not completed, will be taken over. I think it's also important to reinforce council's participation so that when we do get to that end, everybody can support it comfortably. What else did I have? I think that's about it. I'm hoping that we can get the materials on the committee at least 10 days before the 21st date, but if that's not possible, we will all put time aside to go through it. But really encouraging every councillor to participate in the October 21st workshop. And again, thanking staff. It's a horrendous job. Actually, I've chaired committee meetings in Ottawa and here, and this is the toughest one I've ever been part of. So the staff has been really terrific. We've had a couple bumpy moments, but they're doing a fantastic job on our behalf. Thank you. And I'll move the report.
Sorry, I was muted. My apologies, Councillor Sinclair.
Yes, thank you, Mr. Chairman. I wish to make a few remarks from a Caledon perspective here, and I wish to stress throughout this that there's no fault of Peel staff or anyone's staff involved here, but you know, we found the Peel official plan process a bit chaotic for Caledon. You know, this population number swinging around from an additional 300,000 by 2031. Now it's confusing with 2041, and now I see it's 300,000 by 2051. Then we had a lightning strike with provincial significant employment areas, what they meant, and now I'm seeing a lot of residential in those areas. And of course, the on and off GTA West transportation corridor. So we once thought we were on time and running parallel with Peel, and somewhere along the lines now we seem to be quite behind. So I just want to make the point that the notion of a 1 year time period for Caledon to conform to the Peel official plan is unsatisfactory for us. There's a lot of detail in the draft official plan policies that Caledon has to work on, and they're quite challenging in the rural areas. And I think that only 2 open houses digital is problematic for Caledon because we don't have uniform high-speed internet. And I wish to recall the first official plan Peel had that, you know, we had Frank Dale was the chair of planning at that time. And I think there was a Mississauga open house, maybe 35 people showed up. Brampton, maybe 25 people showed up, but there were 3 official meetings up, and one in Bolton, Caledon East, and Inglewood Community Center. There were anywhere from 50 to 120 people at those meetings. And I just point out that Caledon people take their official plans and land uses very seriously. So having that perspective, I would hope that even though there's only 2 open house nights and 1 public information meeting for the whole appeal, we should be looking at some extra effort to solicit public participation in Caledon, particularly in a written form. And those are my comments of just to say where we're at up there and stress the effort for public participation in these difficult times. Thank you, sir.
Thank you. I think Adrian, the Planning Commission, may have a thought on that. Adrian?
Thank you, Mr. Chairman, and thank you very much for the comments this morning. Just wanted to make a quick comment about the challenges with meetings being held, of course, in this time of COVID, and just sort of reassure you that we do continue to kind of monitor the opportunities that there will be. We hope at some point in the future, not too distant future, for in-person meetings, and that we are making extra efforts with the virtual formats to do things. Certainly, the statutory open houses will need to be sort of virtual. Typical virtual Zoom type meetings. In the summer, we were able to hold some virtual meet the planner drop-in events, which were fairly well attended, and we'll continue to seek out those opportunities. And also, we've trying to have opportunities for folks to provide direct comment through virtual means. I know it's not the same as in person, but things like a survey that's available on our website. We've got some virtual storyboards, which are like the old-fashioned Bristol board type materials done virtually, and make those available for folks as well. So we'll take suggestions for further things as well. So thank you for that.
Thank you, Mayor Thompson.
Thank you, and I want to echo what the chair did say. She did an excellent job breaking it all down. I'll just take it one step further. This has been a long exercise from 2013, as you can remember, 2031, then 2031B, 2041, now 2051. We'll roll that all into the official plan. We've been at this too long. It's right. The province is going to give up on us and take over if we do not step up and take this. So I totally agree where it's going. For Caledon, we're going to take a lot of growth, and one is it's great. Well, we can all plan, where the residential and the employment areas are going to go. It's key where our arterial roads are. But as we were discussing even the other night at planning, is we still got to build the bones. How's that transit infrastructure going to work? Which we really haven't had to think about before. We've got to put a lot of bones into the planning to go forward to do this. And this is why it's extremely important where we're going with Caledon. So Adrian, I got a question for you. For both of those virtual meetings, is it going to be the same topic both times? Or is it going to be site specific in certain areas? Is it just going to be the intensification one and greenfield boundary on another, or is it all the same each night?
So, through you, Mr. Chair, thank you for the question. Since these will be the statutory public meetings, those meetings required under the Planning Act, these will be the same sort of overall topics, each of those. In the past, we've held topic specific opportunities for consultation, but for these statutory ones, each one will be the same.
Could you work with the town? And one is because I think what we'll need to go back with council is on this, it's the end of the month, is we want to make sure the libraries are open and accessible, that if people can't get internet at home, they can come into the library to connect, to be part of that process. And it's just one of our avenues that we're using, but we're just trying to find what venues we can use because we do get Caledon participation. We've seen that over the years. It's just our community is really engaged, but I just want to make sure we got avenues. And I'm just saying, is that something that you can work closely with our team here at the town to find out where we can make it accessible for people to be able to get all on and participate in time? And we'll make sure that, those times in the library we can make it available when you have your public meetings, that if public can't get on at home, they have another avenue to get to. So I think this is something that I'm just saying, let's be preactive on this. And we definitely need cooperation from your side, but if we can get that, I'll push staff from this side to figure out how we can make it accessible to everyone we possibly can so that we can get the best product coming out of this that we all can be proud of.
Thank you. Councillor Daskal.
Thank you through the chair. And I just wanted to mention, not officially part of growth management, but do show up on a regular basis for them, because this is big stuff. And you know, we actually had a bit of this conversation yesterday at City Council, knowing that this was coming in today. And I don't think a lot of folks in our communities fully appreciate how big this is, and what kind of impacts this could have. And so what I might suggest is, especially as we're coming into kind of this roaring finish of it all, and it's a lot to digest, to say the least. And I know I've already burnt through one pair of glasses going through a lot of this information. And what I would like to suggest is just to see if we can make some more use of some of the roadside boards that we have throughout the region, the regional boards, just directing people where they can go to this website as well. Adrian, would be my request. My second request is also the city has digital boards in Mississauga at some of the railway tracks, and so I would request that. That's another great avenue to get that out, and so those two places just to help get the word out and put people's attention onto this, because I just think it's just such a critical thing for us at this particular time, not wanting to grind anything to a halt where the the province goes and takes over, because I don't think they've been too kind to the municipality so far with doing this type of stuff. So but I would just say if we could get some more eyeballs on this and more people interacting, I think would be great. So those two requests, if it could be accommodated.
Very good suggestions, Councillor Daskal. Thank you. And the last word to Committee Chair Parrish.
Well, listening to Councillor Sinclair, an idea struck me. We had an event last week that was allowed because the sides of a large tent were open, and we were allowed to have a certain capacity. I'm wondering if we had 3 small in-person meetings up in Caledon and focus them into the 3 major nodes up there that we're concerned about, have a large tent, and have the people that can attend register, and literally cut out developers. If they pre-register, it's the folks that live in Caledon in those areas. And I know it's a big job for our staff, but I think it's doable, because in October, the weather, it may be iffy, but you can always put heaters. But as long as the tents have open sides, the province will allow us to have groups up to whatever the tent can hold at 50% capacity. So I think when we go have our next meeting, or maybe Alan and I can sit down with the staff and see if we could arrange something so you can actually have in-person meetings for those 3 Caledon areas. And I like the idea of opening the libraries and having people who can't get solid internet at their homes. And I'm not opposed to having one of those meetings, for example, in a big tent at Lakeview, Stephen, just to get people together safely. It makes a big difference. You have the boards up, people talk to each other, they understand it better. I'm willing to work on this, Alan, with the committee and our staff. Let's see if we can do something different and innovative and make this a more, I don't know, a more personal type of consultation. And I don't want us to slow down. When you look at the last OP in 2012, and now we're planning to 2051, that's 39 years. Anybody here know what they were doing 39 years ago? I can't remember what I was doing. I'm sure it wasn't anything good, but we were all up to something. But 39 years is a hell of a long time, and I think it's an unreasonable request from the province, and possibly after the June election, it may not be the same gang running the show, but we'll see. I'm not being negative. I'm just being realistic. So I'm happy to work with everybody and see if we can come up with a way that you can have some in-person meetings and we can make them productive if everybody's wanting to go along with that. And I want to thank Ian for taking that little sharp turn. I hadn't thought of it.
Yeah, very good suggestion, Councillor Parrish, worth pursuing, because I think you've got something there, and thanks to Ian as well. Okay, that concludes my list. The report was moved by Councillor Parrish. Anybody in objection of receipt of and the direction in the report? That carries. Thanks to all. Moving on, next item held 17.1, transfer of Embleton Road from the Region of Peel to the City of Brampton as held by Councillor Parrish. Councillor Parrish.
Yes, thank you, Chair Yanika. I'm in favor of this wholeheartedly. I'm sure Mayor Thompson will want to move it. I'm happy to second it. But I would like us to revisit a report that was done through consultants a couple of years back, looking at revisiting transferring all regional roads to the lower tiers. At the time, we had two reports done by the same consultants. One was a report that caused a lot of controversy we weren't thrilled with on Mississauga separating from the region. I think this roads report was done by the same group. So I would like to ask our CAO if we could bring that report forward, revisit it, review it. But I know she's very busy right now. Staff's crazy busy. I'd just like to do it before the next election if we can. So I'm not putting any time limits on it. That was all I wanted to say.
Janice, through to the CAO.
Yeah, so through you, Mr. Chair, I mean, I would say that we certainly could not start that work in 2021. So having it done prior to the election, I think, Councillor Parrish, if we're to go back, it's a fairly complex issue. I think that might be ambitious, but you know, if it's council's wish to relook at it, we could potentially start it in Q1 2022. I think we would have to bring in some external resources to have a look at it and update, I think, the assumptions and the work that was done. I think it's actually been close to 5 years now. So, you know, there would certainly be some necessity to update numbers and things of that nature. So, I mean, we're in council's hands if you want to have another look at it, but I couldn't commit to having it complete prior to the election.
And that's fine with me. I trust you to be able to bring forward maybe a brief report telling us what you think it'll cost, what resources you need, and what your start date is. I know Mississauga's been pushing for this for a long time, and I would just like to have another look at the whole thing from the regional perspective.
Okay, Mayor Thompson.
Can we, I really would love to shunt it to the next term, but as a priority for the next term of council, we got more than we could chew on here in Caledon to get through before the municipal elections next fall. We just, you know, it's cooperation from us as well. Listen, we got so much that we have to deal with the official plan. Let's get through that first. Let's get that off our table, and then we can take on these challenges. I understand where Councillor Parrish wants to go, but I would say, can we just make it priority one for the first of 23 when we have the new council there to make the decisions? Because it's going to take some time. It's old data, but there's a lot of things that have changed, especially after us coming through our official plan here in Caledon. Then I think we could take it on. We just do not have the resources or the time to deal with it in this short time frame where we are today.
Thank you. Councillor Paleshi.
Thank you, Mr. Chair. Just going back to talk about the report, just wanted to thank staff in both the region and the city for bringing this forward. I very much think that Embleton always should have been part of you know, the city of Brampton. So I'm glad that that this is happening, and I'm happy to move the report as the area councillor.
Very good, thank you. And Councillor Parrish.
I would put this to a vote if I have to, but the CAO has suggested she can start it in 2022. I think what we'll be doing is reevaluating a lot of work that's already been done. And I think we can all walk and chew gum at the same time. We can do the MCR process, and there are other things going on simultaneously. So I would like to see this start sooner rather than after the next election. And you'll recall this past election, fully 50% of council turned over. And you'd be starting with a whole new council. And I'll bet if you ask the new ones that came on, it took them a while to get their feeling comfortable with what we were doing and getting caught up. But the region is very complicated. So if I have to, I would move a motion that we ask the CAO to bring back a report that shows what she needs and when she can start, and we will decide at that time.
Councillor Parrish, if this helps, that's what I understood was the direction, and I thought the CAO answered very well. So let me come back and tell you what all the moving parts are, and when that comes back, probably the appropriate time to make a decision, which is what I think you're saying. Alan, can we live with that? Yeah, as I say, let's let the CAO, I think, answered very well. She's going to tell you, here are the challenges, but you've asked me to tell you what all the moving parts are and what is and isn't possible. I think that makes sense to refer it back, and let's deal with the material points then, and we can have a more fulsome discussion. So I'm happy to take that as direction to the CAO as discussed, report to come back, and we'll see where we go from there. Does anybody want to speak in opposition of that? If not, that's resolved and to come back. Okay, moving on. I'm on to other business and councillor inquiries.
Chair Janicka, well, just to be clear that was two separate issues. The first was the actual resolution.
My apologies.
That's correct.
To Councillor Peleche, who has moved the recommendation itself, the transfer of Edmonton Road to the Region of Peel to the City of Brampton. All those, any opposed to that? That carries unanimously. Thank you, Madam Clerk. And the other matter to come back for future direction as well. Okay, that brings me to other business and councillor inquiries. Just one quick one for Mayor Crombie, and she might still like to speak to it. With regards to the Truth and Reconciliation event on the 29th, the staff, and I should have brought this up, but we were in the middle of another subject. That's a staff-driven event for staff that they made us aware of. And I should also have mentioned when, and I've got my scratch pad here in front of me on my desk, my calendar, the dates that were looked at were the 29th and the 30th because it wasn't a council day. And I was told, Chair, you might want to hold both. But then we all know what happened to the 30th. It became the national holiday. And so we lost that date that might have accommodated more, notwithstanding it was a staff event. And that's why we fell to the 29th in advance of the 30th. Reminding you again, it's a staff-driven event, not something through our clerk's office and through my office and what have you. So if that suffices, fine. If anybody has any questions on that, I'll entertain them. But if not, I will ask if there's any other business or inquiries on the part of my colleagues. And hearing none, notices of motion. Hearing none, Madam Clerk, I think I'm in your hands to run the table.
Thank you very much. First, we have a motion from Councillor Parrish, seconded by Councillor Fonseca, that the bylaws listed on the September 23rd, 2021 Regional Council agenda, being bylaws 48, 2021 to 51, 2021 inclusive, be given the required number of readings, taking as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Are there any objections? Seeing none, it carries. And next we have the confirming bylaw, moved by Councillor Sato, seconded by Councillor Santos. Are there any objections? Seeing none, that carries. And that brings us to adjournment.
Okay, a motion to adjourn that I get from Mayor Crombie and...
No, Chair Janicka, I meant to ask during the new business, let me just quickly say that if staff could come back and give us a briefing on how the negotiations are going with the paramedics. I know that they've been making the rounds and they're very, very eager to sign a new contract with the region, and they feel they're only benchmarking to the smaller municipalities. So just an in-camera report at some point.
For our next go-around. Very good. Taking his direction, good idea. Thank you. And if not, otherwise, I have a motion to adjourn from Mayor Crombie and Mayor Thompson. All those in favor, that is carried. Well done in an earlier session with thanks to all of you. I get you out by the lunch hour. Thank you to all. Thank you to our team in the back office. All the best.